Hi, I'm Dr. David Greene with PreferredPainCenter.com, where we bring you anything and everything education for pain management. Today I'm out at Cave Creek, which is a gorgeous area just north of Phoenix. Has a lot of areas that haven't been built on yet, such as this type of scene, and it's gorgeous. The only thing I worry about is wild coyotes coming by and, ripping my arm off or something. The topic for today is why sciatica typically does not need surgery. Okay? How many people are affected by sciatica at any one point in time? Well, it's 1% of the population. So between 3 and 4 million people at any one point in time have burning electrical type pains down one leg or the other from a nerve being pinched by a disc herniation. Okay? And it is very uncomfortable and disabling at times. And it can go on for months. So people think sometimes when they have sciatica, they have to have surgery to get rid of it. And the answer is over 90% of the time, you can get by without it. So how does that happen and why does it happen? Well, when you have a piece of disc that comes out of the inside, and the disc is like a jelly donut, okay? This is the outer part of the jelly donut and the inner part is the jelly. If you get a tear in the outer part, the jelly can squeeze out. And when it squeezes out, it can pinch on, now this is, my hand is the jelly, it can pinch on a nerve root. And that can spark up inflammation, and the inflammation can cause pain to shoot down the leg. Okay? Now, 1% of the population has that. Well, what happens that they end up not needing surgery? Well, first of all, if the pain is not that bad, then it can be watched. All right? The only time you really need to heavily consider surgery is if you start having some weakness, like a foot drop where you can't lift your foot up. All right, that's when it starts to get more serious. But if it's pain and numbness, it's an elective decision, meaning you don't have to have surgery for it. But if the pain is horrific and the conservative treatments that I'll talk about in a moment don't work over 6 to 8 weeks, then surgery should be considered. All right, it's not mandatory, but it should be considered. Okay? Now, when that jelly is hitting that nerve root, the body knows it's not supposed to be there. Okay? The body it doesn't suck the jelly back into the donut, but it can slowly disintegrate the jelly. And if enough of it disintegrates to where it starts to come off of the nerve root and free it up again, the inflammation will slowly go away because the irritant is gone. Okay? So over time, what you see is that the pain will slowly dissipate. So the treatments that are in place, such as the ones that Arizona Pain offers very effectively, are the ones that can help make life comfortable, bring the pain down while that jelly is being disintegrated. None of those treatments are going to cure the problem, all right? But they can make life very comfortable while that jelly is disintegrated away by the body. And those treatments are such things as chiropractic treatment can help free up the nerve root. Physical therapy can help at least take away muscle spasms and free up the nerve root a little bit, as well as epidural steroid injections, because when you have this heavy inflammation around the nerve root, if you inject steroid, it bathes that nerve root in soothing anti-inflammatory medication. And it could be a series of 3, but it can be very effective. Okay? So, but none of those are curing it. It's the Band-Aid. Okay? You put the Band-Aid on the problem, let it sort of take care of itself, and then boom, 90-some% of people don't need surgery. Okay? There you have it. That's why most people with sciatica do not need surgery. If you have sciatica and are experiencing pain, Arizona Pain Specialist is the best pain clinic in the Valley. Multiple locations, board-certified pain doctors and award-winning chiropractors and pain doctors. They take most insurances, including some of the access plans, and self-pay. And there's bound to be one close to you with multiple locations. One number scheduling, 602-507-6550. I'm Dr. David Greene with PreferredPainCenter.com. Your pain stops here.